Well, good afternoon, everybody. I really appreciate y'all coming in to see me today. This is the time of year. This is open enrollment. This is the time to, ask questions, to, really make sure we all understand what benefits are changing, what options we have, what time period we have to make those changes, and, really want to go through all that with you all today. Again, my name is Jonathan Shaw. The name of our company is NFP. It's really important to remember, I'm not United Healthcare or Cigna or Anthem, right? We do not work for the insurance company. We work for you all, right? Think of us as your insurance lawyer, right? As things come up throughout the year, if you got questions, problems, you get a bill, you need service, you need assistance, that's where our team comes in. We want you to utilize our team to help you navigate this healthcare system that we're kind of all stuck in right now together. So I know you don't have a guide or anything, but all of you have your cell phones. So the most important part of the guide that we're going to be emailing out, our 800 number. So go ahead and plug this in your phone. It's 1-800. I'll give everybody time. Cut it off. Look at you. So polite. But it's 800-994-7429. Right? That's our service team. We're in Marietta, Georgia. All right, so we're not sending you out of state or overseas. We speak Southern, right? But literally our job is to help you all. All right? 994-7429. So 800-994-7429. So that's our service team. A year like this, right, where we have changes, this is going to be a year where you're going to want to utilize our team. You may have heard, rumblings, right? It's a positive meeting, in my opinion, but it does come with some change. It's not ideal to change carriers 2 years in a row. We've gone from Anthem, Blue Cross Blue Shield, to United Healthcare, and now, come July 1, we're going to be changing again to Cigna Healthcare for July 1. It's all a money thing, right? When we look at the value of the plans, the plan designs being offered, the projected renewal from these other carriers, there was a significant savings, for the county, for employees to move yet again to, cause this disruption, right? This break in your coverage to take advantage of those savings, to allow us to continue to offer such a valuable, rich plan and actually see your payroll deductions go down, a little bit this year. So all things considered, through COVID, through a couple carrier changes, excited to say, our plan did get better and, less expensive this year with Cigna. The rub, right? The data, anything you've had done right now is not going to automatically transfer to Cigna, right? They're not going to have information on if you've hit your deductible already, or, if you've had a prescription pre-authorized, that information doesn't just automatically transfer over. Getting that data from one insurance company to the other insurance company is the biggest challenge we have right now over this next 3-month period, right? So that's where, again, that number where you, hopefully put into your phone, utilizing us, if you have a large claim or a hospitalization, first part of July, you've already hit your deductible, you don't owe that money. Don't try to navigate all that on your own, right? It's not designed to be done easily, right? It's where we want to, again, utilize us, let us get the paperwork, the documentation in place so you're not out extra money, because the hospital's not going to know, right? They're not going to know you've got that $5,000 already, right? There's some processes we have to come to help make sure that's done. Prescriptions, again, there's going to be an actual 800 number that we're going to send out. I encourage everybody when we send that number out to call it and run through your prescriptions with Cigna. All right, we've looked at a lot of medications. This is a better formulary as a whole and what we've seen, thus far. Comparing what folks covered with Anthem, then United Healthcare, now with Cigna, but every person's different, every drug is different, every formulary, is a little bit different. So if you're on one of those medications that you've had trouble getting filled in the past, had those prior authorizations or those different things that doctors had to complete, again, we want to get a start on those now. We don't want to wait till July 1st till we get to the pharmacy to try to fill a prescription to start trying to start that process, right? So thankfully, with Cigna, we got the paperwork submitted last week. As soon as they kind of set y'all's account up, and we'll be able to start working on those things ahead of time where we didn't have that luxury, last year with United Healthcare, right? So definitely, July, August, September, through the transition, it's going to be some requirements on us, right, to work together, until all this data is closed out, brought to Cigna. That happens late September, early October, typically when it all kind of comes together. So again, know us, know how to utilize our team, know when to. Don't pay something if you don't think you owe it, right? Don't pay something if you don't owe it. Again, make sure you're getting our team involved in that process. Open enrollment, as you recall, y'all's plan year runs July to June. So we're going to be coming out next week, June 5th through June 8th. We'll be at various parts of the county on site here to sit one-on-one with anyone that has questions or wants to go through, the enrollment site. The site itself will be open through Friday. Remember, you can sit down with one of our enrollment counselors. You can call that 800 number and do your enrollment, over the phone, or you can log in, and do your enrollment online on your own. Right? You got 3 ways to complete that enrollment. Just make sure you sit with someone, call, or log in to do that before Friday, June 9th. So the biggest thing, as I mentioned earlier, we're moving from United Healthcare to Cigna. If we got any big services planned or any big procedures, let's get those done in June. Let's get them done with United Healthcare. We can start over fresh, right, with Cigna. So again, we're getting away from the motion. We're getting away from the base buy-up style plan. We really want to simplify the offerings, make a nice streamlined benefit program, really focus on the true wellness program with corporate health partners, really maximizing those things. So you got one very clear-cut plan design to choose from this year. The benefits really match what the buy-up plan was in previous years, but the rates are more consistent with what the base payroll deductions were. So we get a more valuable plan at a lower deduction. We see the deductible there. It's that same $5,000 deductible we've had for several years. Remember, you're only responsible for that first $1,000. Right? The county reimburses anything over that first $1,000 in deductible. All right? So your out-of-pocket liability on that plan for that deductible is just that first $1,000. Right? When you pay for something, it's going to be one of 3 things. It's going to be deductible, it's going to be a copay, or it's going to be coinsurance. Right? In this case, y'all's coinsurance is actually 100%. So you can throw that out. You're going to pay 2 things, a deductible or a copay. Deductible, that's inpatient, outpatient hospitalization. If we go to the hospital, we stay overnight, that's going to be an inpatient stay. That's subject to that deductible. So remember, you're responsible for that first $1,000 of those inpatient stays. Outpatient's where it can get a little blurry. Okay, so if you hear anything above and beyond an X-ray, MRI, CAT scan, PET scan, those advanced diagnostic imaging, right? It definitely matters where you go to get that imaging service done, right? So if you go to a specialist office that can run that MRI in their office, right, that might be a $50 copay. Whereas if they send you across the street to an imaging center, right, that may be $600. If they send you across town to the hospital, that may be $10,000 for that same MRI, right? So it definitely matters where you go. So if your doctor orders, MRI, CAT scan, PAT scan, they say, hey, run over to Piedmont or whatever they're calling it now. It's not Coliseum anymore. Yeah. So now, I think I'm going to check out my prices here. I think I'm going to shop around. If I can find an MRI for $50 or $100, I'm not going to go to Piedmont and pay $2,000 for the same, imaging, right? So know that. Major medical, right? We have a $1 million claim come July 1, right? Your liability is going to be $1,000, right? Once you hit that $5,000 deductible for inpatient stay, those services are covered at 100%. The rest of the year, any inpatient, outpatient service, the 100%. You're only responsible for that first $1,000 of that deductible. So that's incredible coverage. If you ask around any of your neighboring cities, counties, no one has a $1,000 100% plan right now. Primary care specialist visits, again, copays. If we go to a primary care visit, it's a $25 copay. If we go to a specialist, it's a $50 copay. Covers therapy, that's chiropractic, occupational, speech, physical therapy is a $50 copay. Urgent care, you have a $60 copay for urgent care visits. Emergency rooms, a $350 copay for emergency room. Prescription drugs, you got coverage for all 4 tiers of medications, right? There's no big prescription drug deductible. There's no class of drugs that's not covered, right? You truly have 4-tier coverage. Prescriptions is the biggest challenge in healthcare right now. It's the most corrupt system known to man, right? Every formulary, whether it's Anthem, United Healthcare, Aetna, Cigna, doesn't matter. They're all guilty, right? They build these drug lists, these formularies, and they're not designed about what your doctor's prescribing or what works best for you or what genetic makeup of medications works with, that type of biology. It's all a money program, right? So it's a rat race, all these different prescription manufacturers, right? They are fighting to get on this drug list. It is definitely valuable for them to be the preferred medication for diabetes or acne or blood pressure, right? So what they do, Merck, Pfizer, they go to the Cignas, the Anthems, and they negotiate. If you cover my medication as a preferred drug, we will give you a rebate, which means every time that drug is filled, we will pay you 15% the cost of the drug. Well, it's $50, $1,000, $10,000, right? So it's a money thing. This is a money-making program for every health insurance company. So it's between us to help work through that, right? It's not right. I'm very passionate about our medications, very, very passionate. I want to help you if there's a loophole or there's a way, to get these things done. I'm there to help you, right? I didn't make the program. Some of these medications will be excluded, right? I mean, that's just the nature of the beast. But if there is a way, to get a medication covered, I will, certainly find that way, right? So just know that. With that being said, everything we've seen on this formulary, there's a handful of individuals we've looked at medications. We're really excited, with the results so far, but do please continue to let us know if you have issues, problems, challenges. Again, please engage our team. As I mentioned earlier, the deductions have gone down slightly, right? So we were able to create savings both for the county and employees as a whole, again through post-COVID years to have insurance going down. You know, we're really happy. Something certainly is going right with all that, and that is wellness. Right, this wellness program that I know Tiffany, we got to give Tiffany a ton of credit. She's really, really, keeps that program going, rejuvenated on time. And that's still a big part of y'all's strategy, right? If you continue to participate in the wellness program, if you do the screenings, the coaching, you can reduce your payroll deduction down another $25 a pay period, right? That's real money. And there's an additional $1,000 that we can meet now this year on top of that, just by hitting and reaching little goals that you meet, with your health coach. This, as silly as it may seem, as you're going through those visits, this is why our costs are going down. These little visits are preventing heart attacks, strokes, pre-diabetes from turning into diabetes, having diabetes diagnosed and managed as opposed to being unmanaged. These things add up through time. It's risk management and really clean prevention. So that's the whole concept there, and it is certainly working. The rates, the plan is a testament of that. The county's still going to embed and strengthen y'all's plan with the BRELA supplemental benefit plan. If you haven't taken advantage of that yet, please check that out. I personally use that about, how long ago was ACCG? 6 weeks? About 6 weeks ago, I had a concussion. My son threw me off of a go-kart. Got to test out BRELA. But very easy from the ER. Pulled the app up on my phone. Took a picture of my wristband and my discharge paperwork, and I had $300 in my Venmo the next morning, right? So the whole concept, there's 13,000 different conditions. It pays you $200, $500, or $1,000, right? 13,000 different conditions, and this is if you go to a doctor, if you go to an urgent care, emergency room, admitted to the hospital, get a prescription for. Anytime you're at a doctor or leaving a doctor, you need to just get into your kind of program as I'm going to check BRELA, right? What did I get checked for today? What did I get diagnosed with today is one of these covered conditions. It's literally like Google. You just type in the conditions. But we know that there's money there, right? So if you've been to the doctor this year, urgent care, hospital, sit down, with one of our folks, call BRELA, go through that. It's super, super easy to file these claims, but this is designed to help you take that $1,000 deductible, right? The county's already eaten the other $4,000. We still got $1,000 we got to come up with, right? If you got some major service, that's the whole concept of that BRELA. So if you're sitting there, you've been to the doctor, you say, BRELA didn't pay me anything, I didn't look at it, there's still time, so please take advantage of that. You'll see in your guide, that preventive coverage, again, goes right in line with the wellness program, the wellness strategy that we have. Prevention is the key. It's early detection, early diagnosis. I've met a lot of guys, most time, that are healthy, right, that never go to the doctor, that pass away from a heart attack a year later because they never went and didn't realize they had a high blood pressure, high cholesterol, those things that $3 medication can manage, right? So that's the whole concept. That's what the wellness program is really just around awareness. So remember, preventive services are covered at 100%, right? So you shouldn't see any charges for your physical, mammogram, pap smear. It lays it out here for different, child preventive tests that are covered, women-specific preventive services, adult preventive services. The key there is when you make your appointment. Okay, it's so important. A preventive visit has to be coded as a preventive visit. All right, so when you schedule your appointment, hi, I'm Jonathan, I want to come for my preventive physical. All right, that's step one. Step two, when you're signing up and they take your insurance, Mr. Shaw, you owe $25 today. Like, no. Like, this is a preventive physical. I know this isn't a copay, right? You need to put that as a preventive down there, right? Because once you give them that copay and they file the claim as an office visit, that money's gone, right? So just know that. If you're going in and you know you want that preventive physical, make sure you schedule the appointment that way. Do not, give them money. Just know your benefits. So we did talk about the HRA. So again, if those of you are out there, if you've had a major medical, you've hit money towards a deductible, if you've got bills out there, remember, you only owe the first $1,000 of that deductible. Right? So if you've got a bill for a hospital for anything over $1,000, that's where we need to talk. The HRA is designed to help you guys, right? So we do know that there's probably some money out there for folks that just maybe not taking advantage of the HRA, not knowing what to do, right? So please, if you've had an outpatient, inpatient, something that's applied to that deductible, get with us, get with our team, let us help you, make sure you get your money. There is a definite lifespan on that, right? So you only have really till March of next year to file for something that happened this year, right? So this doesn't just go in perpetuity. So if you've had a claim, please get with us, help us, let us help you get your money. Flex spending. I'm a huge fan of, legally reducing my tax obligation. I'm a huge fan of really allowing my dollars to go as far as possible. That's the whole concept of a flex spending account. So this is designed specifically for medical expenses, qualified medical expenses. So prescriptions, doctor's visits, dental work, vision, chiropractic care, acupuncture, deductible, you name it. There's a whole list of qualified medical expenses. But what I go to is prescriptions. I think everyone should look and think, I'm on 3 prescriptions. I know I pay $50 a month for these 3 prescriptions. I'm paying that $50 a month no matter what. Right? I need those prescriptions. So I'm going to have $50 to buy those prescriptions no matter what. So the question is, do I want that $50 after tax, or do I want that money pre-tax? 100 times out of 100, you always want that money pre-tax. You get that out dollar for dollar, right? That brings down your taxable income, so you're going to pay less in taxes and have more that helps you pay for these qualified medical expenses, right? So we're going to have more money by putting that $50 into a flex spending pre-tax than not putting it in there and spending that $50 after the fact for those same medications, right? So that's the idea. So think of it as a tax-free upfront loan to yourself. Okay, so you make an election, you can get up to $3,050 a year into that flex spending. You got access to that money from day one, right? You hadn't put $3,000 in there. It comes out evenly every pay period pre-tax, but you do have access to that full election amount, from day one, right? So if you got a service or a plan in major, dental work or some type of procedures, you can use that very strategically. It's no longer use it or lose it. In so many, in previous years, the downside is if I put money in there and I didn't spend it, it went away, right? Now, that's not the case, right? You got up to $500 in rollover protection, which means you can have $500 left. That $500 will roll over. You will continue to have it the next year and the next year, the next year till you spend that money. So I think it's very smart for everybody, at the very least, to put $500 a year in there, right? That way you got a credit card that's got $500 on it that's not going anywhere, right? That's going to come out pre-tax if you get in the snag that will roll over to future years if you don't use it, right? So just keep that in mind, but it's certainly designed if you do have some expenses, it's a great way to reduce your taxes and increase your take-home pay. So on the line of changes, so not only our health insurance, but we've changed dental and vision. We're moving all of our coverage from Anthem Blue Cross Blue Shield to Cigna. So we're going to get 2 new ID cards. Our medical and vision are going to be on one card, and our dental, is that what I said? Yeah. So our medical and vision, if you get those 2, will come on one ID card. If you enroll in dental, it'll also come in a second card. So you're looking at potentially 2 cards for 3 insurance coverages. So know that. But again, you have 2 plan options to choose from. You know, a base plan and a buy-up on dental. It's all about where you want to go. All right, so for our base plan is designed for you to stay in network. All right, it has Gray Dental. Who's our local dentist?
Dr. K.
Dr. Moore.
Dr. K.
Dr. K and Dr. Moore. If you go there and you're good with that, you can go in network. That low plan's great, right? If you're on the low plan, you want to go and make sure you see an in-network provider. If you're on the low plan and you go to a non-participating provider, you're going to see balance bills, right? Because this plan pays off of a contract, right? This very low amount, much less than what most of our dentists are charging. So you, the consumer, are kind of left to make the difference up, right? So it's very important, if you're on that base plan, to make sure you're using an in-network dentist. If you look there and you say, I don't go to K, I go somewhere in Macon, right? So that's where the buy-up plan is designed to come in. It is an open access plan. It allows you to go see any dentist that you want to go see. It pays based off of what that dentist charges, right? So it's not a insurance contract saying we'll pay this for a cleaning, this for a exam. It's saying, you know, what has 90% of the dentist charged for cleanings in Macon in the last 30 days, right? So it pays based off of what your dentists are in fact charging. So it's super important to understand that fact. Aside from the benefits themselves, the network is really the big driver here. You know, if you're comfortable going to an in-network dentist or one of those in-network dentists, just the same as you had with Anthem and Emeritus in previous years, the base plan's perfectly fine. And if you want to go see a non-participating dentist, as you've been doing, then you're going to want the buy-up plan, right? A couple of other features there. The buy-up does have a little bit more in benefits. So instead of $1,500 per person, there's a $2,000 benefit per person on the buy-up plan. But the buy-up does cover orthodontia. This is for children only. That's to age 19. And that's a brand new lifetime maximum. So we've been told that even if you've used orthodontia on a child in the past, he or she has a new shot at $1,500 of orthodontia benefits for services done after July 1st of this year. Vision, again, same concept. It's moving to Cigna, right, with the providers there. It's the same national chain type retailers. They use the same iMed network, right? It's just going to be on a different card. But think of this as materials insurance. You know, you only need vision if you need glasses or you need contacts. Right? If you don't need glasses or contacts next year, don't get the vision. You can add the vision any year. Right? It only is valuable if you're going to use it and use it right away. So you do get an exam benefit. It's just a $10 copay. That's just a basic exam. All right, if you need the contact lens fitting, it's another $40 copay for that. If it's the premium, lens fitting and follow-ups, it's a 10% discount. right? So it's not a ton of value, not a ton of bang in the exam part, right? The sizzles in the materials themselves. So you get a lens benefit and a frames benefit. For lenses, you have to choose, right? Do I want single, bifocal, trifocal lenses for my glasses, or do I want contacts? Right, you get one lens benefit every year, so you got to choose. If you use it for contacts, you get a $130 benefit towards that first order of contacts, and then a 15% discount on the remaining balance. If you use it for lenses for your glasses, it's a $20 copay. So that's single, bifocal, trifocal plastic lenses. All right, so if you need the scratch resistant or tinted or premium progressive, no, there's additional upcharges for those lens enhancements. For frames, you get a frames benefit every 2 years. All right, so a pair of frames, you get a $130 benefit towards a pair of frames, and then a 20% discount on the remaining balance, right? So very straightforward, $3.20 a pay period, ton of value there again if you need the glasses, if you need the materials. If not, it'll be there for you next year. The county does provide everybody with some basic life insurance. So employees are covered at $20,000, spouses at $5,000, children at $2,500. Super important, for those of you that, all of you are in here, so y'all are somewhat concerned with benefits, but other folks in your department say, I don't need to go to that meeting, I'm not on any of the insurance, I waive everything. You need to remind them, hey, you still got that free life insurance, right? Make sure they got that coverage on your spouse or your child. We got to have them in the system, right, for the coverage to get in there, right? It's not just automatically happen, right? So if you know someone out there, make sure they've come, they get that free coverage, make sure they, get their beneficiaries in the system. So there's a reason for everybody to sit down, even if you don't, want anything. They do make available the additional group term life insurance. This is not a true open enrollment, so anybody that wants to add coverage this year or wants to increase coverage this year would have to complete health questions, right? So if you want to add life or increase your life insurance, we would ask that you probably sit with one of our enrollment counselors. There is a 3 to 5 page little health questionnaire that we'll want to kind of help through and get that submitted. That can definitely slow down the process, right? Because those things have to get sent off, those things get underwritten, and it can take a month, it can take 6 months, and there's nothing worse than something like life or disability, not knowing if you have the coverage or not, right? So we really want to make sure we streamline that process as much as we can. So if you want to add coverage or increase coverage, please do sit down with one of our enrollment counselors to get the E of I done. Short-term disability, again, you're provided with short-term disability. It covers 2/3 of your weekly income. This is designed as paycheck insurance, right? It covers 2/3 of your weekly income. Elimination period 7 days, right? So it would have to be out, whether it be an injury, whether it be a sickness, whether it be an accident. For 7 days, this benefit picks up on the 8th day and would carry you for 26 weeks. There are no pre-X limitations on the short-term disability. They also make available long-term disability coverage, right? So this is if you want coverage above and beyond that 26-week period of time. The long-term disability to me is right up there with retirement. It's health insurance, retirement, and disability insurance. You are your most valuable asset, right? Your ability to provide income for yourself, for your family, to retire, to pay off our debts, right? If we're no longer able to work, we're physically disabled, this makes sure you have a check coming, until you hit your Social Security retirement age, right? You can stall your creditors for 26 weeks. You can't stall them forever, so that's the whole concept there behind the long-term disability. Is it covers 60% of your monthly income. Again, it would pick up after that short-term disability coverage was exhausted, and would cover you all the way to your Social Security normal retirement age, or till you come back to work. All right, so true long-term disability benefit. With the Lincoln, y'all do have some really good employee assistance program. Right now it's really tough with stress, anxiety, mental health. I don't know if anyone's tried to book an appointment with a mental health specialist right now. It's not easy. There's a very long waiting times, and it's very, very difficult and can be expensive. A lot of them don't accept insurance. Kind of the same deal with the dental. But you do have access to face-to-face services, confidential services at no cost through the EAP program. That's for personal matters, family matters. There's a really good tool that if anyone here doesn't have a will created, don't pay a lawyer, $500 to draw up a will. Don't go on LegalZoom and pay $300, right? You can draw up your will, print it out, get it notarized here. I'm sure y'all have a notary somewhere around, and have an official legal document, right? So highly encourage everybody, if you don't have some type of basic will, having someone kind of going through some of that makes things a lot easier on everyone. So do take advantage of that. Again, it's through Lincoln's Employee Assistance Program. How many benefits you gonna offer them, man? Good grief. It's the longest book ever. Last but not least, supplemental benefits. Supplemental benefits are made available through AFLAC, and it's the same concept as the BRELA, right? These supplement your health insurance. These pay you to help you cover what insurance doesn't pay. Mainly deductible, y'all's out of pocket. You don't really have to worry about that, but if you're out on a extended leave, there's groceries, there's power bill, there's all kind of different bills above and beyond just health insurance that come into play if we have some type of major health event, whether it be a critical illness, cancer, heart attack, stroke, diagnosis, paralysis, or some type of accident that requires, emergency care or life flight or urgent care or something to that effect. So both of these policies, again, are designed to give you access to a large level of protection for a very specified circumstance. The critical illness, you get to choose a lump sum benefit, anywhere from $5,000 to $30,000 that pays you, if you're diagnosed with one of those covered conditions, heart attack, stroke, cancer, paralysis, end-stage renal. I hate talking about this slide. Loss of speech, loss of sight, loss of hearing, Parkinson's, advanced Alzheimer's, things of that nature. If you get diagnosed with one of those critical conditions, it pays you, that full lump sum amount. It's available on spouses. Dependent children are automatically covered at no cost, so it's covered at 50% of whatever your lump sum amount is. This plan also includes a wellness benefits. This is going to pay you $50 if you go get that preventive physical, or that if you see corporate health partners, or you get your annual screening or one of those preventive services. This plan pays you every year for having that done. Accident, again, my parents would have made a ton of money on me, my brothers and I. I broke about every bone you can think of trying to play football, but But the accident plan is just that, right? Accidental injuries, emergency room, urgent care. If you have an injury that requires medical treatment, doesn't matter if it's a doctor's visit, urgent care, telemedicine, emergency room. Again, you're riding an ambulance. You got to have surgery. You got a broken arm. Doesn't matter. There's some type of an accident. This plan pays you, right? Again, to help you cover that emergency room copay or that deductible or that time out of work, right? The schedule of benefits on the accident's about 30 pages long. Just know that the worse the injury, the more it pays, right? It pays more for a broken leg than it does for a broken pinky, right? But anything as a result of an accident, whether it's the transportation, the follow-up visits, heaven forbid a death, all those things are paid through this plan. Hospital indemnity, same deal. This is specifically for if you're admitted to the hospital. Right, so if you want to insure that $1,000 that you know you're responsible for if you get admitted to the hospital, the easiest way to do that is through the hospital indemnity plan. Right, this covers if you are admitted to the hospital. Doesn't matter if it's an accident, doesn't matter if it's a sickness, doesn't matter if it's a covered condition. It is hospital admission, period. Right, so that's the concept there. There are no pre-ex on this plan. So that's super important. Maybe not this year, but y'all need to remember that. Okay, if you start talking to your doctors, things go wrong or things are happening and you have a procedure planned or they're talking about a major surgery potentially, you want it to be sometime after July 1, right? We want to go ahead and get this hospital indemnity plan because there's no pre-ex. I could be a woman 8 months pregnant. I could take out this policy, and it's going to pay when I'm admitted to the hospital for that maternity, right? So if I know I'm going to have knee replacement surgery or something, where my mind goes is, okay, when's this scheduled? How close is that to open enrollment? Is there a way for me to work this out in my favor, right? So just remember that. No pre-ex on the hospital indemnity. Really good opportunity, especially for those of you you have some type of service coming up. Last but not least is the permanent life insurance. So everyone in here, we all have that group term that the county provides, and all that's really good. That's designed to give you access to a lot of coverage while you're working. Okay? It is meant to be very low cost because the probability is that you're all going to outlive it, right? Because it is not designed to be a permanent policy, right? It is a group term policy. These are just 1 year terms that you're kind of renting this coverage through while you're working, which is great. It's what Clark Howard's, what all the major financial people would encourage you to do. You want to cover your big life insurance amounts through employer sponsored benefits. The permanent life, you have to put yourself post-enrollment, post retirement. I'm 70, 80, 90 years old. Okay? You want to make sure, whether it's through the county, through an independent agent, through someone online, you want to make sure you have some type of life insurance secured for when you retire that you already have. You don't want to start looking for permanent life insurance when you're 70, 75, 80 years old. You want to go ahead and lock something in now, 10, 15, 20,000. You don't need more than that, right? This is a final expense type policy. This is to make sure I know, check off the box after retirement. I know I'm not going to straddle my kids or grandkids with any type of final expenses. I know I have a life insurance policy that will not go away, that I can keep, that I can afford, that will be there. So that's the concept of this Texas Life. For those of you that have not, gotten some type of permanent life insurance solution, that's where the county makes it available. You can get that on yourself. on a spouse, on children, and even dependent grandchildren. And you do not have to have a policy on yourself to take one out on a spouse, child, or grandchild, right? So you could take a policy out on your spouse, a spouse could take their policy out on you for this one specifically. So, but with that being said, about right on time, really. I will be sending out, or Shannon will be sending out an email later this week. It'll have a copy of the guide, and we're waiting for that number from Cigna for you all to be able to call in to talk about your prescriptions, identify if anything's going to need any prior authorizations or any of that stuff. So please do be on the lookout for that, and we'll certainly have all that information ready when we're back on site next week for enrollment. But with that, I know I've thrown a lot of information at you. And I'm happy to answer questions here as a group, or y'all can come see me, if it's more personal in nature, or, if I just killed it and y'all don't got any questions,
I got one.
Oh, damn.
Preventive medicine, is that through Cigna, or is it gonna be through you, Colonial, or somebody?
Preventive medicine. That's covered through Cigna.
Okay.
Yes, sir. Excellent question.
What about telehealth visits?
Cigna has some telemedicine. I need to get that information. You'll want to go to like Cigna.com and establish a myCigna.com account. But yeah, telemedicine, all the good stuff. I think there's a copay for those though. What's your email address?
Marion, M-A-R-I-O-N,
M-A-R-I-O-N.
dot H-A-T-T-O-N,
Hatton?
yes,
Mm-hmm.
at jonescountyga.org.
And Shannon, I'll get that to you too. All right. Any others that I can not answer today? Yes. For Cigna, they use LabCorp or Quest, so it's very easy there. They're one of the few that doesn't really make you jump through hoops. But when you go to your provider, right, your provider, that when they are in network with Cigna, they agree to send that to Quest or LabCorp. So if a provider sends one to the wrong lab, that should be on them. Okay. Now there are a handful that, be careful what you sign. Right, there are a handful of doctors I've seen that have people sign that says, "Hey, I'm responsible if they send it to the wrong lab." But most of
They
the
have their own lab there, as long as their own network, we're cool.
correct. Yes, yeah, that's ideal when they have the labs in there. Yes, ma'am.
Is Cigna POS or PPO?
It's a point of service. Yes, sir. So same concept as a PPO. It's a national network. So it's a point of service here in the state of Georgia. If you leave the state of Georgia, you got access to the Cigna PPO. But
And it's what now?
it's a national network. It's a point of service network. You don't have to get referrals. There's no funny HMO, rules or regulations. So full coverage, national network. Good question.
And you did say it was IMED?
I said it was Cigna on the card using the iMed network. Yes, sir. But yeah, you'll go in and they'll see a Cigna card, but it's done through iMed.
Bet your deductible for this year
Mm-hmm.
to carry on.
It does, but it's not. There's some stuff that has to happen, right? So we have to get an EOB or some information from you to Cigna so they can update your profile. Okay. For United Healthcare, they'll do it all in one batch. Okay, but they'll only do it once, and they have to wait for all the claims to get done processing. right? So they can't even start this till July 1st, right? Unfortunately, aside from prescriptions, nothing else processes in real time, right? So anytime you go to a doctor or hospital or emergency room, there's lag, right, from when you go to when the claim gets filed, adjudicated, and then paid, right? So all that crap has to happen. All the claims got to run out. Again, it's going to be late August, early September before we get a clean file that Cigna can upload, right? So anytime before we get that file, and between 7/1 and then, if you got a hospitalization, someone's coming at you with money, you gotta just let us help you, and just understand it's not ideal. We didn't draw it up saying, hey, let's change carriers, the next 3 years and see how fun we can make it on the employees, but United Healthcare had other options for us. Anthem had other options for us, but I think the money talks, and we're real excited with bringing deductions down, keeping the value in the plan, and putting our team to help kind of just bridge this little short-term gap here. But you shouldn't pay anything, but if you go to the hospital, they're going to ask you for it. Okay, Cigna doesn't know that you've paid it already. You know what I mean? So just call us. Did you book our number? 800? All right.
Also, when will we find out about the meds that I'm taking for diabetes?
Yep. So there's going to be a number that's going to be sent out. You're going to need to call that number and have your medications. All right. You're going to be calling Cigna directly, right? And they're going to pull up your medications with your formulary once they've built, Jones County's plan, and we can already get started. Say, hey, that one needs a prior authorization, or that one needs a doctor's letter, or whatever it may be, right? We can start that process now, as opposed to having to wait and react in July like we did last year. Yeah, but there will be some for sure, and that's every insurance company.
Oh, I know.
Yes, sir. But they're good, and I know one was very challenging. Was very, very pleased with one of the medications that was covered relative to Anthem and United Healthcare being denied. So this employee was very happy. It's an expensive one, so I hope for the same results.
So how long do I have to request medical? Because I'm new here. So I won't get insurance for 3 months. So do I have a deadline before I sign up for this?
You need to go through open enrollment.
You need to go through open enrollment.
Can I stay here?
It's been a good group. Well, with that, please come see us. Our team will be out here on site. Our service center is happy to help you. If you need me, Shannon, Tiffany know how to get in touch with me. Please do. Contact me. I'm happy to help you any way I can. Thank y'all.